Welcome, everyone. Thanks for joining us today with this PPMD and PTC webinar on EMFLAZA landscape in 2024. We're really glad you're here. 2024 has started off to be an interesting year as we think about the rapidly changing Duchenne approved therapies landscape, which is great. This is a new problem that we've not had before, but it also brings with it lots of questions and lots of conversations that need to be had to help empower you as families to understand your choices, what options are available to you, how to navigate them, and what supports are in place for you. So today we are joined by the team at PTC. We have Frank, who is the head of patient engagement, Tasia, who is head of marketing, and Greg, who's head of patient services. And they're each going to talk through a little bit about PTC's drug EMFLAZA, its upcoming loss of exclusivity, what that means, what it doesn't mean, and what some of those implications are in terms of continuing to have access to EMFLAZA in the coming months and years. So as a reminder to everyone, we are recording today's webinar, so you can use this as a resource moving forward, and we're also taking questions. So if you have questions as we're speaking, go ahead, drop those questions in the chat, and we'll try to work through as many of those in the Q&A section after the formal presentation is complete. So with that, let's go ahead and dive in. I am going to hand things over to Frank.
Thank you, Rachel, and thank you for the opportunity to speak with the community on EMFLAZA and give some updates. We've had some questions, so I know it was of interest to have this opportunity to discuss EMFLAZA and the landscape this year. So quick agenda, we're going to talk a little bit about PTC and introductions for those of you that may not be too familiar with PTC. We'll talk about generics and dispenses written, and then Greg will talk about PTC Cares, and then we'll do Q&A. So PTC was founded in 1998. For those of you that are not too familiar with the company, we're based in New Jersey, and we're actively engaged with discovery and development of products for rare diseases. We really pride ourselves in partnering with the communities that we work with, specifically the Duchenne community, who we've been involved with for all of those 25 years. So as I said, we've been around 25 years now, PTC, and it started back in 1998 with the discovery of Adalurin, so Translarna, as it's known in some countries. And we continue those efforts here in the US, and you can see our timeline here and with our work in DMD. But specifically for this webinar, we're going to talk about EMFLAZA and what's called the loss of exclusivity with EMFLAZA. Now, as EMFLAZA is FDA approved, I want to just briefly need to cover off on some of the important safety information. So I'll just briefly hit a couple of highlights, but please know that more information, all this information in more detail is available at EMFLAZA.com in case you want to dive deeper. So EMFLAZA is a prescription medication for DMD in patients 2 years of age and older. When should I not take EMFLAZA? If you have a hypersensitivity to deflazacort or any of its inactive ingredients. What are warnings that I should know about EMFLAZA? It can cause changes to endocrine function, so please speak to your healthcare provider about that in more detail. And then EMFLAZA can cause cataracts or glaucoma. So again, speak with your healthcare provider about that and any of these important safety information. You should tell your provider if you have any of the below medical conditions prior to starting EMFLAZA. And if you have any of the side effects described above, including facial puffiness or weight gain, please contact your healthcare provider, or you can report your adverse events at the number seen below or the email address. Also directly to the FDA, you can report those at those numbers on the screen. I want to introduce you to the PTC patient engagement team. And this team prides itself in connections with the community. So hopefully you've had the opportunity to see some of these members at some of the community events we participate in, both nationally and regionally here in the United States. So our patient engagement team works to collaborate closely with the communities and help to answer questions, build partnerships, and really find goals that are aligned with the community. We pride ourselves in working together with the communities to help further educational opportunities primarily, and help those individuals and families who may be looking for answers along the way and help connect them to other resources within the community. So a lot of what we do is connecting with different resources, including PPMD. Our email address, if you haven't yet connected with a patient engagement liaison, please give us an email or a call at the numbers below. We've got educational opportunities we have specifically from PTC called Navigating Duchenne. We also have a series called Insightful Moments, and those are available also in Spanish. And you can see our Spanish number at the bottom there, phone number as well, for any Spanish-speaking families. They can call directly and speak to a Spanish-speaking patient engagement liaison. So with that, I will hand it over to Tasia, who heads our marketing team.
All right, thank you, Frank. As Rachel mentioned earlier, there have been a number of changes in the EMFLAZA landscape in 2024. First, we asked you to update your insurance information late in December and early in January with PTC Cares, so that PTC Cares can work with you to make sure that you have access to EMFLAZA. Second, EMFLAZA is facing loss of exclusivity in February 2024, so that's soon. This means that a generic version of EMFLAZA called deflazacort can be produced by other companies. However, we don't know yet if this will happen now in February or at a later date in the year. We just know that it is possible for a generic version of deflazacort to enter the market. Once a generic is available, you can still stay on EMFLAZA and have access to PTC Cares by requesting Dispense as written or DAW. You as a caregiver can directly contact your physician or a pharmacy to stay on EMFLAZA. One last note on generics is that a generic medication, especially specialty generics, could have a higher out-of-pocket co-payment for you or your family, and may also have different ingredients than EMFLAZA. So what is Dispense as written? Dispense as written, or DAW, helps your doctor or you preserve your choice of medication, specifically branded EMFLAZA, if you or your doctor decide that it is the right option for you. Dispense as written, or DAW, is a request that your doctor signs using a specific code, and that is called DAW1. Your doctor signs or handwrites DAW1 on the prescription start form for EMFLAZA, and then the pharmacy is no longer allowed to substitute a generic version of EMFLAZA if it has been signed by your physician. There is also a request called DAW2, and a DAW2 is a request that you can directly make to your pharmacy to stay on EMFLAZA. If you are switched to a generic, you can still call your pharmacy and ask them using DAW2 to be dispensed the branded version of deflazacort, which is EMFLAZA. So in summary, DAW, or Dispense as written, is a way that either your doctor or you can be empowered to request the branded version of EMFLAZA. How does your doctor request DAW? PTC has been working with your physician's office over the last 6 months to ensure that they are indicating on their prescription start forms to request DAW. That happens via our start form that you see here. In some instances, doctors use e-prescribing or electronic prescribing through their electronic medical record portal, and they can also indicate Dispense as written 1 or DAW1 using their online system for refill prescriptions. I will now hand it over to Greg to talk about PTC Cares and how they can help with this process.
Thank you, Teja. I'm Greg Iovine, and I have the pleasure of heading up patient services here at PTC and working with this amazing team of 16 case managers that you see before you on this slide. I'm sure you recognize Carla, Rick, and Rachel from our video series. You have Jackie in there and Alicia, all amazing case managers. Our team has a lot of experience and great combined skills in medical billing, HCP office experience, so pharma office staff as pharmacy technicians, and basically they'll be able to. There hasn't been much that they haven't seen yet up to this date. They should be able to help assist you to stay on EMFLAZA in the event that your doctor or pharmacy or the insurance is looking to make a change to generic. So they'll stay with you from the beginning of your journey all through staying on EMFLAZA. 5 of our case managers are actually fluent in speaking Spanish. If that is your preferred language, they'll be able to help you directly. Each case manager is a single point of contact, so they'll be working with you as well as your doctor and being able to keep that communication very cohesive. In the event that one of our case managers are not there that day, another case manager will easily be able to assist you. So our patient assistance programs are in place to ensure your access to EMFLAZA, as again, I'm sure most of you are aware of. We have our copay assistance program that's for patients that are enrolled with PTC Cares and have commercial insurance. You'll pay as little as a $0 copay, as you've seen. Our bridge program is for patients that are enrolled in PTC Cares that might be experiencing an interruption in therapy. This allows us to be able to give you a temporary supply while working through these barriers with your insurance and working with your doctor. Lastly, a small change that you might see is to our EMFLAZA Start program, or our ESP program. These are for patients that are looking to re-enroll with PTC Cares. So if your insurance, your doctor, or the pharmacy, switches to a generic medication or generic deflazacort, this will easily help us be able to get you back on drug quickly. If you do find yourself in this situation in the next couple of months, speak with your doctor to make sure that you meet those requirements so we can get that process started. So, just wrapping up, as generics or alternatives become available for EMFLAZA and doctors and insurances start making changes, there's an amazing team of case managers and patient assistance programs in place that are ready to assist you to stay on EMFLAZA or come back to EMFLAZA. When you're scheduling your refill with the pharmacy, if you receive something other than EMFLAZA, or you receive deflazacort, or you're asked about deflazacort, you could always call us and let us know, and we'll be able to help you stay on EMFLAZA. You can call us at 844-478-2227, and your case managers will always be happy to assist you. Thank you.
Great. Thanks so much, Greg. I think that this is really helpful. Tons of really useful information. As a reminder, we do have the chat open. So if you have questions for our speakers, go ahead and drop those in the chat now. If it's all right, PTC team, I do have a couple of questions on my own notes that I think y'all can speak to. So let's start with Greg. So I think the information that you had about PTC Cares was super helpful. I'm thinking about that third scenario that you mentioned, where patients might have been on brand EMFLAZA, perhaps they go on generic for a time, and there's an intolerance, there's an allergy, there's some sort of mitigating factor they want to get back on brand. Can you talk me through that process in a little bit more detail? Am I starting back at the very beginning with a start form and like starting from scratch? Or am I able to kind of jump the line and pull upon some of that information that my case manager had from when I was on brand before?
Yeah, and I think you're alluding to exactly what we would do is give that case manager a call. obviously also speak to your doctor to make sure that that ball gets rolling again. And, if you are eligible, if the patient is eligible, we will have that ESP program where we could start them up quicker, gather that information, and, and hopefully get you back on track.
Perfect. And a follow-up question to that, and you might not either have an answer or be able to answer, but I'm thinking about that same individual who might have had some sort of intolerance or allergic reaction to a generic and needs to get back on brand. We know that those scenarios are rare, but they do happen. Would bridge drug be available to those individuals while they're going through that New Start program?
I mean, the ESP program would take care of that if you're coming back. If they're being taken off drug, obviously we would do the best that we can to assess for bridge to see how that works, and then work with your doctor to try to get through that barrier, because it would be a barrier.
Cool, thank you. I think that's really helpful. And then I think this next question, I'm looking at one that is in the chat, is really helpful. And I think it's going to go to Greg, but you all correct me if you're wrong. And that's around copay assistance. So I'm thinking about both copay assistance programs and PTC Cares. Are those going to be available in 2025 and beyond? I know that we're sort of in this new sort of space in 2024 and resources are available for now, but what about longer term? Are you able to speak to what that might look like?
I mean, right now in this point, PTC Cares and our copay assistance program are here. So I mean, through 2024, and then obviously, hopefully beyond.
So to be determined is what I'm hearing. It's hard. It's hard to tell the future, right? We don't know what this is really going to look like. So I want to acknowledge that there are a lot of unknowns here, sort of on both sides of the coin. And then last sort of easy question, I think for you, Greg. So love that you all have Spanish case managers available for families who prefer to communicate in Spanish as their preferred language. Do you have accessibility for families who are speaking other languages like Arabic, Mandarin, other languages that might need some assistance?
Yeah, our case managers have access to a language line that they're able to use with interpreters. They get on pretty quickly. We do use them fairly regularly, and they work out pretty well.
Perfect. Okay, cool. I've got another question here, and I don't know who the right person is, or if perhaps this might even be one that we need to follow up on after the fact. But the question is around DAW denials and if we're able to appeal a DAW denial if insurance sees that request for DAW and says no. What does that look like?
I think that's mine again. So we haven't gotten one of those yet, simply because it hasn't happened yet. But I'm pretty confident our team is they're master troubleshooters. So they're going to take that, they're going to interpret it, and then to your question before, ask for any follow-up information to speak with the doctor about, to be able to make the best case possible if that's what the patient and the doctor wants.
And
So
I'll
yes,
also go. No, that's perfect. And I'll go a little bit off script and refer back to a webinar that we had here a 3 weeks ago about just general drug access, whether brand or generic or something else entirely. And we learned a lot about the different tiers of medication classes that insurance has and what that process can look like in terms of copay and authorizations that are required. And so that would be something where you would generally work really closely with your medical team to go through an appeal process, provide supporting documentation to support overturning that appeal and getting access to brand if that is what you and your medical team determine to be most appropriate for you. Okay, let me see here. I think, Tasia, you alluded to this a little bit. But can you just highlight for us, how is brand different or not different from generic? I think Tasia might be frozen. He looks pretty frozen to me. But I think that it's something that's important to highlight. So when we think about brand versus generic drug, we generally think of that active ingredient being the same, but potentially seeing differences in those inert or inactive ingredients. And generally speaking, we would expect that efficacy would be the same, generally. However, that is not the case for everyone. And so I think, before making any big changes, you would want to speak really, really in depth with your neuromuscular team, talk through risks, benefits, ask those questions before making any big changes. Greg, Frank, would you add anything to that?
Yeah, I think that was perfect, Rachel. Thanks, and apologize for Tasia dropping off there. He had a poor connection. So, yeah, you answered it perfectly. Yeah.
We totally understand the tech limitations of this virtual world, so no worries. And then I think I have just a couple more questions for Frank. So you provided a really nice overview of your patient engagement team, and I know that I've had the privilege of interacting with many of them. They're a fantastic group. Can you help us understand what the difference is between the patient engagement team and those case managers?
Yeah, good question. Thanks, Rachel. Patient engagement team, as we say, is our field-facing or customer-facing individuals. And like I said, they're often at the local regional events and the national events. If there's a PTC booth that is at a community event, it's more than likely one of our patient engagement individuals. So they like to make connections and have relationships with the broader Duchenne community. And it's, a different basically group that is not only there for patients on EMFLAZA, but for any patients in the Duchenne community.
Perfect. Thank you so much, Frank. I think it's really great to see how you have these different groups of people within the PTC family who are serving the community in different capacities and really trying to provide that sort of wraparound type of engagement, which is just fantastic.
Tasia back. So that's good.
I see it. Tasia, welcome back.
I got kicked out, but maybe one of my colleagues picked up that question.
Yeah, I maybe answered my own question, but it's fine. No worries at all. We were talking a little bit about differences between brand and generic, which you had alluded to a little bit in your slides. So I think we're all right there. I see one more question here that I think is a good one. And I'm not sure who the right person is to ask, but I'm going to just throw it to the group. And it says, should we be contacting our pharmacy to see how the prescription was written as DAW? And I think that this is kind of a hypothetical, right? Because generic is not technically available and brand is dispensed through a specialty pharmacy. So who would like to sort of tackle that question?
Yep, I could take that. I mean, as the weeks go on, as the pharmacies are contacting you for a refill, maybe at that point in time is when you ask, and if they're looking to, make sure, hey, am I receiving branded EMFLAZA? Right, this way that you know what you're getting. Same thing if you receive something other than EMFLAZA, you can question it. You could always call us at PTC Cares so we could help you.
Absolutely. Frank, Tasia, anything that you wanted to add?
Yeah, no, I think that's good. I mean, it's always great to be proactive too, right? If you do have a concern and you want to stay on branded EMFLAZA, I'm sure a quick call to the pharmacy just to see how it's loaded in and make that request is certainly acceptable.
Just to add, as Tasia mentioned, you could always let them know about that DAW2. So on their side.
Yeah, DAW1 is a request the doctor's office makes to the pharmacy. And if there's any question, you could also make a DAW2. So I don't think there's anything wrong with being proactive as a patient or a family.
Absolutely. And I think, something to think about is that, as I alluded to earlier, this is all hypothetical right now. There currently is not a manufacturer on the market providing generic deflazacort in a commercially available way in the United States. So an additional qualifier, this pertains to individuals who live and reside in the United States, because that's what we're talking about with the FDA and licensing and patent I don't know all of the right words, but effectively, this is US specific information. So if you reside in Canada, Europe, elsewhere in the world, this is a different conversation. But currently generic is not available, and your prescription was not written with a DAW because it wasn't necessary or indicated, because only brand has been available. I think another question to kind of think through and talk to your medical team about might be in regard to where you would potentially get generic drug, because it may or may not be at another specialty pharmacy, because it's still something that doesn't have a broad indication. So it may not be available at something like a Walgreens or a CVS. You still might be working through that specialty pharmacy. So there's a lot of questions that I know the PTC team doesn't have the answers to either, that we're all trying to just kind of like work together and understand sort of some of these implications, because we're going to learn a lot, and we might see somebody come on the market with generic drug in the next few weeks, or we might not, and we simply don't know. I think one of the other questions is around cost and what generic cost might look like, and how that could even potentially impact the cost of brand. And Frank, correct me if I'm wrong, but that remains sort of a question mark for us as well.
Yeah, much like the availability question, Rachel, that you just answered, and thank you for addressing that too. We don't know, right? Because a generic hasn't launched, but more than likely it won't be available at your, corner drugstore because of the indication, and more than likely we would anticipate also any generics going through a specialty pharmacy. But as far as costs, yet to be determined and seen once a generic launches, and like Greg spoke to earlier, the copay programs that EMFLAZA has in place are intended to have little to no out-of-pocket costs for branded EMFLAZA. So hopefully that's not an issue in the community currently, and we don't know what generic manufacturers will have in place at that time.
That's exactly right.
Yep.
And I want to kind of remind everybody that despite all of these unanswered questions, PPMD and PTC too want to continue to be a resource to you as the Duchenne community as you navigate sort of this new landscape. We're looking at other drugs coming on market. We're looking at loss of exclusivity. We're looking at all of these different pieces, and it can be really confusing. It can be really overwhelming. And we do have lots of content and resources available to you all via PPMD for You, our website, different types of resources, our webinar library. These are all places where you can go for information to help you sort of answer these questions as they come up, because we're talking about these concepts now, but they might not be applicable until 6 months from now. So please continue to use us as a resource and utilize PTC Cares and the different programs that PTC is able to provide to help sort of navigate these questions. With that, I would love to give you all on the PTC team the last word. Any closing comments for us?
Just for me, I want to thank you again, Rachel, and the PPMD team for letting us have this opportunity to talk with the broader community and make ourselves available. Again, like Rachel said, don't hesitate to reach out. We've shared the numbers, and work with your healthcare providers and the PTC Cares team going forward. So thank you guys so much. Appreciate it.
All right. Thank you so much, Frank. Again, this was recorded. It will be available in the coming days on our website. Y'all can go back and rewatch it or share it with other caregivers, folks on your medical team. And again, we did have that webinar here a couple weeks back about the pharmacology and the basics of prescribing brand versus generic and some of those different implications. That's a helpful resource as well. And we are here to connect with you if you have questions. You can email me, Rachel@parentprojectmd.org, email my team at careteam@parentprojectmd.org. We're happy to connect with you directly, answer more specific questions that we weren't able to get into today. And we're here for you, and we're grateful for you tuning in and joining us today. Thank you to the PTC team. And with that, we'll go ahead and wrap today's webinar. Thanks, everybody.
Thank you.
Everyone.